everyone, and welcome to Talking Mental Health, a new series from the Wellness Project where we discuss hot topics in the mental health and wellness field with mental health professionals, specifically as they relate to college and aged young adults. I'm Allison, and I'm your host, and today I'm here with Nishan. Nishan, do you mind introducing yourself for everyone?
Yeah, my name is Borden. I'm a licensed mental health counselor in the state of Florida, and I'm also an assistant professor in the clinical mental health counseling program at Jacksonville University.
Very cool. So today we're going to be talking about anxiety and depression. So we're just going to go ahead and go into the questions if you're ready. So our first question, very basic, what is anxiety?
So anxiety is a feeling of worry or nervousness or unease. So it's typically about an imminent threat or harm or danger that's going to come. So everyone experiences anxiety, right? And anxiety can be productive. It can help us to get ready for things like, oh, I know I have a test coming up. I feel anxious about it. It's going to encourage me to study, so I get ready, right? I have a public speaking thing coming up. I feel anxious, I'm going to practice so that I'm ready. But when anxiety becomes problematic is when it is excessive, right? So this threat and this fear is present all the time and it's irrational, right? Nothing is really going to happen, but your body and your mind is working as if harm or danger is going to come your way. So when it becomes diagnosable is when it's present for about 6 months.
Yeah, that was super interesting too. I appreciate that you added that part about how anxiety can be present and can help encourage you to do things, but there is that line between a healthy dose versus an unhealthy dose. Because I don't think I've ever made that connection before of that like background encouraging. So I appreciate that.
Oh, no problem.
Yeah. So and then also, what is depression?
So depression, very similar to anxiety. So it's those feelings of sadness, worry, angst, feelings of loneliness, emptiness, and it's like I said, very part of the normal part of the human experience to feel sad. But when depression becomes problematic is when that sadness is persistent. So it lasts for days. It impacts the ability to get up, to get moving, to take interest in things that you normally would take interest in. Makes it hard to sleep, makes it hard to eat. So it's sadness, but when it becomes depression is when it is prolonged and it starts to impact your ability to function.
Okay. So I feel like there's a heavy emphasis on both of those on ability to function, where it crosses that unhealthy boundary.
Definitely. So if you look at like diagnostic criteria for anxiety and depression, they look very similar. And because of the human experience, we're going to feel anxious, we're going to feel sad. But when it impacts that ability to function is when it becomes problematic and a mental health concern.
Yeah. Thank you for sharing that. So our podcast is primarily aimed for college-aged young adults or people who are working with college-aged young adults. So I'm curious now too, how are these present amongst college-aged young adults? Do you have any sort of, like, not necessarily statistics, but just how have you seen it present?
Yeah, so some studies say that about 60% of college-age young adults report anxiety and depression. I think it's also important to note that anxiety and depression are usually comorbid, and it could be because the symptoms for anxiety and depression, they overlap, but also because of how the brain works. Those symptoms usually are produced in the same part of the brain. So some studies say 60%, some studies say up to 90%, and then recent studies conducted during the pandemic show even higher numbers. So college students are more anxious and depressed maybe now more than ever in history. And I don't know if that's because we have more access to them to collect data or, mental health is becoming more prevalent, so people are more willing to disclose. But college students really have a lot of pressure on them. So should I add to that?
No, that was great. That was great. I would, if you're okay with it, are you able to explain the word comorbidity?
Yeah, so comorbidity means that 2 or more diagnoses exist at the same time. So usually a person comes in, they can be diagnosed with anxiety, or a person can be diagnosed with depression. But for it to be comorbid, they have to be diagnosed with both. So if you have ever been anxious, right? If you've ever had an anxiety disorder, you could understand how that might lead you to feeling sad and to feeling isolated or to feel depressed because you really are not able to turn those negative and intrusive thoughts off, right? They overtake your life, they're overpowering. And that can cause a person to just feel frustrated and lonely because they cannot control those negative and intrusive thoughts.
Yeah, thank you. I've heard the word before, but I wasn't sure if I could quite explain it, so I wanted to also have that little piece in there.
Mhm.
Um, what are some common treatments of both anxiety and depression?
Yeah. So, the best treatment for anxiety and depression would be a combination of medication management and talk therapy. So, if you come into a counselor and you're feeling anxious, you're feeling depressed, most of the time they might start with some cognitive behavioral therapy. It's an evidence based treatment. So, that means studies show that it works. And what that really focuses on is thoughts, feelings, and behavior. So if a person is anxious, if a person is depressed, that really usually starts with their thoughts. So they want to start challenging those negative thoughts, challenging catastrophizing, what people tend to do when they're anxious, when they think the worst possible outcome is going to happen. If I
Mhm.
um, get a bad grade on this test, then I'm going to fail this class, and then I'm going to have to drop out of college, right? So that's what anxiety
Mhm.
can do. It can take us down this spiral. So they're going to
Yeah.
start wanting you to kind of identify those thoughts and how your thoughts lead to feelings, negative feelings, and how those feelings impact your behavior. So let's say if you're anxious and you're depressed and you're not getting up to shower, or you're not going to class, or you're not socializing with your friends anymore, you kind of withdrawn from all the things that bring you pleasure. One of the things your counselor is going to do is try to help you to start those things back up, to change your patterns and your behavior. So hopefully you can see some improvement in your mood.
Yeah, I appreciate that you not only mentioned going to therapy, but you also kind of explained what would go on in a therapy session. Because I
Mhm.
feel like that's where a lot of people get stopped because they're like, yeah, I should probably go to therapy, but like what's going to happen once I'm there? And I
Mhm.
think that a lot of that fear steps in and they're like, well, I don't know what's going to happen. It's unknown, so I don't know if I want to go kind of thing. So I appreciate that addition of like here's what'll happen within the
Mhm.
session.
Yeah, going to therapy can be scary. I'm a therapist and I've been to therapy, and I can, from my own personal experience, I know it feels very unnerving sitting on the other side of the couch. But I think what is important to know is that the counselor is there to support you on your journey.
Mhm.
They're there for your best interest. And they're not going to ask you to do things that you're uncomfortable with. They're not going to ask you to disclose at a pace that's faster than what you're comfortable with. So you really are the expert on your own life. You're guiding the work that you're doing with your counselor, and they are basically the guide on the side to support you throughout that process.
Yeah. Another kind of thing that we've looked at a little bit throughout this project is peer support. So I'm curious if there are any ways peers can offer support to someone with anxiety and depression or depression.
Absolutely. I think peer support is so important. So some, outlets report that up to 75% of college students who need support do not get it from a mental health professional. So what peers can do is be aware of the signs and symptoms of mental health concerns such as anxiety and depression, especially because prolonged depression can lead to suicidal ideation or suicide attempts, which is the third leading cause of death among college students.
Mm,
So, having peers that know the signs, that know the symptoms, that can recognize, when that anxiety and depression has impacted functioning. Also, being able to access campus resources. So sometimes peers may feel the need to kind of take over the role as the helper or become the therapist or the doctor, which is really not in their skill set, right? So if they
mhm.
become aware of an issue that a peer is having, knowing where to go. So if you live in a dorm, you can go to your resident assistant. Most college campuses have an ombudsman, which is a strange word, ombudsman, who is like a person who can help connect them to all kind of resources. Um, they can tell a professor in their courses that they, have a peer that they're concerned about, and to help get that process started. Also, being willing to contact family. When I was at the College Counseling Center providing counseling services, it would be a lot of times peers would walk their friends into the counseling center because they knew they needed help, but they just didn't know what to do. So also listening and providing a safe space to talk without judgment is going to be super important if a person is struggling.
Yeah, I'm curious. You mentioned at the beginning of this question that being able to identify and recognize signs
Mm-hmm.
within, a friend. And I'm curious, is that something that's just innate, or are there trainings? Are there ways to kind of do better with that kind of stuff, I guess is my question.
Yeah, I would say it's not innate. And I think when college students have, more responsibilities now than ever. The process of getting to college is harder now than ever. So when they come into college, they usually have had these really punishing and grueling schedules. I read an article recently said that, high school students have schedules that rival that of a CEO, because from first thing in the morning to late at night, they're involved in activities. They're constantly doing things to build their resume up so that they stand out to a college. So I would say that most college students they're just used to that level of functioning, so they don't realize that it can be dysfunctional how they have been operating for years. So I would say that it's not well known to recognize the symptoms of anxiety. Social media also really normalizes being anxious, being OCD, being very emotional and depressed. So I would say that we could do a better job of providing that psychoeducation about what anxiety and depression actually is.
Yeah, thank you. And I appreciate that aspect of social media too, because I've definitely seen that. The like, I've made it to emotionally unwell TikTok, and it's like a thing people are celebrating. And I'm like, well, I don't know. So it is interesting to take that side into of like normalizing it all.
Mm-hmm. Mm-hmm.
Um, so this kind of, I guess I should have attached it to a question a while ago, but what are some possible coping skills? I know everybody copes a little differently, but I'm curious as they relate to like anxiety and depression.
Yeah, so it's definitely, so the good news is that prognosis is good for anxiety and depression. If people get help, they're able to get that professional treatment, they usually will improve. So I would say one of the things that is going to be important is to try to have a balanced schedule. So college students can be super busy. Most college students have 4 courses in a semester. They're involved in clubs. They might be student athletes. They might be working a full-time job to pay for college. So as much as they can, trying to balance out their schedule, making sure they're getting adequate sleep, eating healthy, balanced meals, limiting their alcohol and caffeine as much as they can, and learning some things that they can do to kind of control that anxiety when it comes into their body. So doing counting, taking deep breaths, practicing grounding activities. And I'm kind of giggling because one of my clients said, how does counting help feelings? And I said, it might not necessarily help your feelings, but it can help you to calm down so that you can be more aware of your feelings. Is this feeling rational, right? Is this feeling true? Because feelings are not facts, but they can feel like that in the moment. So getting help, so talking to someone is a positive coping skill. Trying to have outlets where they are connected with others and it's not focused on work, but just focused on, building community and socializing is going to be important. And also learning just to identify those triggers. What has made you feel anxious? What has made you feel sad? And going through that process to do some fact checking. Yes, I'm anxious, but is this a real or imminent threat? Is this something, what is, I'm kind of jumbling my words, but I think sometimes we believe the outcomes that we have and the scenarios that we have concocted in our minds, and we can go through the process of asking, is this true? And most of the time it's not.
Yeah, gosh, there was so much of that I want to pull out. That was so good. First, I loved that phrase you used, feelings are not facts.
Mhm.
Because I mean, even me personally, I feel like I get stuck there sometimes. And so I feel like it's so easy to get stuck there. And so I've never heard it put like that. And I think that's a beautiful way to say it. Feelings are not facts.
Mhm.
Um,
Feelings are valid, but they are always not true. They are not
yeah,
always true.
yeah. And then I also appreciate too that when asked why, well, like you said, counting, what does counting do? What is counting going to do? I love that explanation of why, because I feel like that's another thing that stops us is like, well, here's a coping mechanism that you could be using, but why am I using it? What is
Mhm,
it for? What is
mhm.
that actually going to do for me? What is counting going to do for me? What is a deep breath going to do for me? And so I appreciate your explanation on some of those things and how they kind of work with anxiety and depression. So
Mhm.
thank
And they don't always work the first time.
you.
So I know even I'm guilty of this. My counselor has given me homework or I've tried something and it didn't work immediately. So I abandon it and I don't go back to it. But if you have been anxious and riled up for months, years, the first thing you do is probably not going to fix you or rewire your brain or calm down your nervous system. It really is a prolonged effort in trying these things out until you find the one that works for you and then doing them all the time to get them incorporated into your routine. So
Yeah, it's
I'm sorry.
yeah, you're good. You're good. It's not a one size fits all, which I feel
No,
like is just such another big misconception when it comes to coping skills therapy, all the things.
exactly.
Yeah. So I just have one more question. And this one we kind of talked about beforehand because while we were introducing ourselves, I heard you mention counseling centers. So I'm curious. I feel like something that should be more well known on college campuses is that, to my knowledge, the majority of college campuses have a counseling center, a place
Mhm.
right there for you when you need it. And so I'm curious, how do college students access those?
Yeah. So you can call your college counseling center and make an appointment. Because of the pandemic, that's really opened up how they're providing services. So when I was working at a college counseling center, it was just face-to-face counseling. Now many college counseling centers are offering telehealth services through a
Mm,
HIPAA compliant safe platform. I know another thing we did at the counseling center is that every day one of the counselors on staff provided emergency coverage. So that was a period during the day that a person that was in crisis or in need could just walk in and get services immediately. Um, you can, if your college counseling center is not available to you or you are not on campus to access those services, you can always, if you have insurance, I know it's a privilege to have insurance, you can contact your insurance provider and see if you can get some services that way. And because of the pandemic, again, services have really opened up because insurance providers and insurance companies are offering reimbursement for telehealth services. Um, and usually if they have a list of counselors in the community who are willing to provide sliding scale services to college students because they know that they usually don't have the income to pay those fees. So
mm.
there are services available to college students if they know where to go to access them.
Yeah. And I just wanted to like reiterate this too. I think I heard you say earlier that counseling centers can be for someone in crisis, but also someone who knows someone in crisis, right? Like that can be a place where you can go to what I don't know what to do in this circumstance.
Absolutely. Absolutely. So if you have a friend who is struggling and you're not sure where to get them help, but you're super concerned about them, the counseling center is a place that you can seek out support. You can also go to a professor or a resident assistant or, any staff or faculty on campus should know how to connect you with the right person, right? So they may not know where you can go to get that help, but they should be able to point you in a direction. So I know a lot of times college students are the first responders. They're the one that's spending a lot of time with their peers. They're living together. They're in classes together. So they really have an eye and a beat on what's going on with their peers. So they can really help with combating mental health on college campuses.
Yeah. Well, thank you so much for being here today. I mean, this was wonderful information. I've really enjoyed the conversation we had. I think it's been super informative. And it'll be such a good piece to normalize some of this stuff, to get people talking about it more, getting access to things that people don't know they have access to. So I really appreciate that. So thank you so much for being here.
Oh, thank you for having me.